Hello and welcome to Module 156, ladies and gentlemen. We're going to be discussing a couple of key things for Chapter 1. The very first thing I want to make sure that you know is this is the book that we're in Module 156, and we're going to be going from Chapter 1 to Chapter 7. There's lots of great information in this book, but I am going to be hammering key terms because so many of these key terms are on your NCCT. The second thing that I want to bring up to you guys is, let me find one real quick. There's lots of documentation in your book. You need to make sure that you know what this documentation is. And we'll be talking about it, but it just gives us great resources to actually be able to see what the documents look like. You're going to have different kind of boxes. You're going to have blue boxes, which is your critical thinking. And then you have green boxes, and those are easing the transitions. I don't do a lot of that. I'm going to be doing a lot of the critical thinking, and I'm looking for a specific box so that I can show you when I say brown box, what I'm going to be meaning. Well, of course, it's going to take me forever to find one. Okay, here we go. For example, it's on page 33. If I say brown box, or EHR exercise, or BB, brown box, EHR exercise, that's what I'm talking about. It's literally a brown box. So those are some of the things that are a little bit different. There are not long chapter reviews in this little book, and we do not have a workbook for this book. What I want to advise are, this is not advice, I'm telling you that you need to follow these instructions to register this book online, please. Just follow these instructions and you should be fine. Okay, so let's begin to talk about Chapter 1, Introduction to the Electronic Health Records. Now, I am going to go through and tell you which key terms that I think are the most important for you to know. Of course, I want you to study all of them, but I'm going to give you some to put big stars by. Account ledger, chief complaint, co-payment, day sheet, electronic health record, EHR, electronic medical record, EMR, encounter, meaningful use, or MU, patient information form, super bill or encounter form, and third-party payer. So I need for you to make sure that you star those and you know that those are very, very, very important. I did not choose documentation because I thought you guys all kind of know what documentation is. So there's no reason for us to expand on that too much. I'm going to be giving you a Quizlet that has these terms on it, all of them. You can do your flashcards and learn, and there will be a weekly quiz just on key terms, unless I tell you that we're not going to do that. But most definitely in this first chapter, you will have a quiz on the key terms. And it'll be just Quizlet, guys. So you guys are familiar with that. You'll take your quiz, and then you will tell me what you made. Okay? All right. So I want to grab, well, I moved my slides over here. I want to talk to you about something first before we get into anything else. I want to talk to you about the definition of EHR versus EMR, electronic medical records versus electronic health records. Now, you may think, well, only one word is different, correct? Medical and health, it's different. But when you take the NCCT or you're talking about any other valuable information between these two softwares, you want to know what the difference is. So I am going to tell you the difference. Electronic medical records is one practice. One practice. So electronic medical records are a digital version of the paper charts in a clinician's office. And EMR contains the medical and treatment history of the patients in one practice. EMRs have advantages over paper records. For example, EMRs allow clinicians to track data over time. easily identify which patients are due for preventative screenings or checkups, check how their patients are doing on certain parameters such as blood pressure readings or vaccinations, monitor and improve overall quality of care within the practice. But the information in EMRs don't travel easily out of the practice. One practice. In fact, the patient's record might even have to be printed out to be delivered by mail to a specialist and other members of the care team. In that regard, EMRs are not much better than a paper record. So EMR, one practice. Okay, electronic medical record, EMR, one practice. Now, EHR, electronic health records, do all the things that the EMR does, but more. EHRs focus on the total health of the patient, not just for one clinic, but the total health across the board. Going beyond standard clinical data collected in the provider's office and inclusive of a broader view of a patient's care. EHRs are designed to reach out beyond the health organization that originally collects and compiles the information. They are built to share information with other healthcare providers, such as laboratories and specialists. So they contain information from all the clinicians involved in the patient's care. The National Alliance for Health Information Technology stated that EHR data can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. Okay, now there's lots of other information, and I know that you see me reading this. You will have a copy of this attached to our little Zoom lecture here. So let's talk about what information does an electronic health record contain in EHR. So let's talk EMR, one practice. EHR, across the board. What information does an electronic health record contain? Here's the basics of that. It contains patient health information such as administrative and billing data, patient demographics, which means name, address, phone number, insurance, things like that, progress notes, vital signs, medical histories, diagnoses, medications, immunizations, allergies, radiology images, lab and test results. So an EHR is more than just a computerized version of a patient's chart. Remember, the EMR is just like a patient's chart, except it's electronic. It's just like a patient's chart. But an EHR is so much more than that. It's a digital record that can provide comprehensive health information about your patients. EHR systems are built to share information with other healthcare providers and organizations, such as laboratories, specialists, medical imaging facilities, pharmacies, emergency facilities, and school and workplace clinics. So they can contain information from all clinicians involved in a patient's care. So the way that I'm kind of remembering this is EMR 1, EHR mini. Okay? Let's talk about what are some benefits of an EHR. EHRs are real-time, patient-centered records that make information available instantly and securely to authorized users, sorry. While the EHR does contain the medical and treatment histories of patients, an EHR system is built to go beyond standard clinical data collected in a provider's office and can be inclusive of a broader view of a patient's care. EHRs can contain a patient's medical history, diagnoses, medications, treatments, immunizations. We've said that before. It can allow access to evidence-based tools that providers can use to make decisions about patients' care. It can automate and streamline provider workflow. So what kind of impact do you think an EHR has on a patient's care? What do you think? Let's look. Our world has been radically transformed by digital technology. Smartphones, tablets, and web-enabled devices have transformed our daily lives and the way we communicate. Medicine is an information-rich enterprise. So you gotta have the information, and there's lots of it when you get it. A greater and more seamless flow of information within a digital healthcare infrastructure created by electronic health records, EHRs, encompasses the leverages digital progress, and can transform the way care is delivered and compensated. With EHRs, sorry about that, guys. With EHRs, information is available whenever and wherever it is needed. Improved patient care, increased patient participation, improved care coordination, improved diagnostics and patient outcomes, practice efficiencies, and cost savings. So that was a lot on EHRs and EMRs, right? It was a lot. I'm going to put this phone in this desk drawer because I turned it off and it's still ringing. So it's so important for you to realize the difference between the two. So what I want you to do is to get into your book, and I want you to answer a question for me. And I'm looking because I want to get the question right, and I did not plan for this. I want you to give me the advantages of an electronic health record. I want you to give me the advantages of an EHR, and I want you to give me the disadvantages of an EHR. So I will put a copy of this attached to this video, and you will have the assignment to tell me pros and cons of an EHR, advantages and disadvantages. Have a great day. Let me know if you need anything. See you guys soon.